Hi everyone. In this video we're going to be discussing what is going to be found in your monitoring box for your spays and neuters. These will be found out in the induction area. Each of them are labeled with a number, and all of the equipment in the box has the same number. So when you take stuff out, make sure it's got a 4 on it or a 5 or a 6. And when you put stuff back, it should all have the same number. On the side of the box, it shows what's going to be located in here. You'll have your Doppler unit with the battery charger, the BP cuff sizes in a little baggie. That will also be numbered. There will be 5 cuffs, and there should be 5 cuffs at the beginning and 5 cuffs at the end. Your sphygmomanometer, get that out, which is also labeled. The ultrasound gel, we want to use ultrasound gel and not lubricating jelly so that we can get the best contact with the crystal on our Doppler. Pulse ox, and the pulse ox cords. The only other thing left in your box is going to be the bed jet warming device controller. So let's talk about the pulse ox and the care of the pulse ox and putting together the pulse ox. This is your pulse ox unit. It should have 4 new batteries in it. We open up the back, open and turn it around, and we got 4 nice batteries. I've already checked them. Closing it back up. In your bag, you will have 1 pulse ox cord and 1 pulse ox extension cord. You should not need the pulse ox extension cord, so we'll put that back in the bag for now. When handling the cord, there are the end that goes to the unit itself and the end that goes to your patient. This lines up like a little puzzle piece. So we're going to push that in and make sure that it fits nice and snugly. All right. Anytime you remove this to put it back in your bag, please don't pull on the cord or on the white cord or on the piece. Pull it out from down at the base. Turning it on is the middle button. We're just going to turn it on until it lights up. It's always good to check this before you put it on a patient. So I'm just going to take off my glove. And I'm just going to check it on a small finger. Doesn't matter which side the light's on. And we're just going to wait and see. What we're looking for is a green large light here. It'll show what our pulse ox is reading on top and what my heart rate is reading down below. If you do not have the large green light, we need to reposition it and find something else to put it on. The little orange light just means that there may be some sort of alarm, which you don't have to worry about right now. And then there's a battery indicator light. If that one's flashing, we need to get new batteries to put into the pulse ox. To place these on your animal, you're going to gently pull the tongue from the mouth, and at the tip to the side or either side of the tongue, gently place these on the tongue. It doesn't matter, once again, which side the light is on. It just matters that you have a good contact all the way across the 2 light emitting diodes so that there is good penetration through. If for some reason you find that your pulse oximeter is reading lower, try taking it off your patient and putting it onto another portion of the tongue to see if it will read a little bit better. When we're done with this, we're going to remove the known-in piece, which is the part with the probe on it, gently. If there's gotten anything on it, just take a wet gauze and kind of wipe it down. Being careful that there are some little wires back here that we don't want to disrupt. And we're going to put it back in our bag. Notice I've got 4 and 4. We'll move on to the Doppler now. With the Doppler, you're going to need a roll of tape, your sphygmomanometer, your bag of BP cuffs, and your ultrasound gel, along with the Doppler unit itself. The Doppler unit has 2 pieces, the main piece which has the speaker in it, and then the Doppler cord and crystal. You'll see that it comes in a nice plastic bag with a little red cap on it, and we also want to keep those 2 pieces with your Doppler. The little red cap will be secured to the Doppler cord via a piece of string or suture. So we're going to remove that, and here is your Doppler crystal. One of the first things I like to do before I place my Doppler on a patient is test it on myself to make sure that everything is working appropriately. We will take the ultrasound gel and put a small dollop right on the top of the crystal at the end. There are 2 sides to the crystal. There's a concave side and then a flat side. You're going to want to use the concave side. Now, I don't know if you've ever taken your pulse before, but I usually find mine to the lateral aspect, although I'm a human, of right underneath my thumb, and that's where I'm going to probably find my pulse now. I'm going to turn this on and turn it up to about medium. Yay! So I'm going to gently release that so we don't make a whole bunch of noise and turn it back off. To clean the pulse op probe, I'm just going to use a damp gauze and be very careful. The gauze should be used with water only and not alcohol or any other cleaning detergents. I'm going to clean myself up too. In terms of placing your Doppler, you'll need to also have your clipper ready and waiting to go, and a long piece of tape. So we'll get those ready. The only last thing that I have to do is to size my cuff to my patient. Please remember that the cuff width should be approximately 40% of the diameter of the appendage you're going to place the cuff around. I'm going to place the Doppler on the hind limb of my patient. Looking at our patient's paw pads, I'm going to clip up from the base of our most proximal paw pad about 2 centimeters. We'll just get that off to the side. And as you can see, I'm down to about the skin. This can also be done on the front pad also. I'm now going to take my Doppler and put the same amount of ultrasound gel on that I used earlier for testing it on myself. I know that my artery is going to run right down the mid space of my tarsus. So I'm just going to place my pad, or my crystal, at the base of the pad and tape it on. Some people do like to try to find the pulse prior to taping. I find that this works just as well, and you don't end up losing it in your grip. The cord is coming out the bottom and away from the patient. I've pre-sized my cuff, and I'm going to put my cuff on the patient fairly snugly. The cuff then attaches to the sphygmomanometer via this lure lock. From there, I can then pump up the sphygmomanometer until my desired pressure, and then let it go so that I can then hear as the blood comes back into the leg. On our Doppler unit, we have several different pieces. We have the on-off button. We have a battery light that will blink if it's not charged. We have a volume button that can be raised and lowered, and then a cautery suppression, which you shouldn't have to touch. Then there will be our two electrode probes coming in from the Doppler crystal. The number on the probe should match the number on the Doppler. We want to make sure that they're the same number so that we get a good connection. Once our procedure is done, we're going to take everything off, and everything can be wiped down with a rescue wipe, with the exception of the crystal. So we'll wipe all of our pieces down, disconnect them, and put them back into the bag that's labeled for our basket. With the Doppler crystal, once again, we're going to be very gentle. We're going to take off the tape. Wipe it down with a gauze that's been wet in water, with water. And make sure we get all of the extra ultrasound gel off. And then we're going to take our red cap, put it back on, and very loosely roll the wire back up and put it in the bag. After that, everything goes back into our blue bucket. And goes back to the supply cart.